Okay, so on the maxillary, again, I'm using the face. I am extra oral fulcruming for my hand. The back of my hand is on the patient's face, and I'm using the face of my instrument to start at the, take a look at my tip. It's only adapted on the anterior third. It does not look like this, where it's all touching. Just the anterior third. Starting at the line angle, working my way in, using the face, make sure I get all the way into that hole. Again, up and down vertically or sweeping horizontally if I find calculus. This is where a lot of calculus will be supra, so you can follow up here and just do a quick stain on the anterior third supra to remove any stain and calculus straight on the buccal. And then work your way down from the supra into the stub. And you're going to, again, sweep. You can do about half the tooth at a time. Sweep, find calculus, you'll tap down on the calculus and then follow up by sweeping. And then you'll come around to the next part of the tooth. And I don't like to stay in one area too long because even if I found a piece of calculus here, I don't want to continue to touch that. It's going to be uncomfortable for the patient. So what I'll do is I'll move on. If I try to get the piece, I can't get it, I'll move on. I'll move on to this part of the tooth. I'm on the lateral side of my tip now, working my way into that hole. Take a look at my terminal flanges away from the tooth to adapt. And I'm making sure I get all of that, then drop my tip and come under the contact. And then I might go back to that piece again. Okay, let me try it again. Do a few strokes again. And then I'll move on again, or I'll go back a couple of teeth, make sure I got everything, and then move again. Okay, and that's your buccal. Same on the lingual. So on the lingual, we'll have the patient turn towards us, and we'll need to use a mirror. So we can't not use a mirror. So we'll have a mirror on the lingual, which we can't use for the video. So let's see. Let's keep this a little bit more. Okay, and on the lingual, again, we're on the face of the instrument for the direct lingual, coming into that whole area. I'm standing up for the distal to get the tip adapted correctly, working my way into the distal, and come out, and then do the line angle, and come around the lingual. Now I'm using the lateral side. Look at my tip is adapted, so my terminal flange is not touching the tooth. And I'm working my way around the tooth. When I get to the mesial, I'm still on my lateral side, working my way in. And I'm going down, not up like a stairs, so down onto the calculus with my lateral side, and all the way into the hole, and then follow up by coming around the contact. Again, do anything supra also. Make sure you get all stain and supracalculus off. Kind of color it like this very, very quickly. Get all of it off.